Are you caring for aging parents or loved ones? These 20 health tips could literally save their lives, from fall prevention to nutrition to Alzheimer's warning signs. Don't wait for a crisis. Let's dive into what really matters. What should seniors pay attention to when it comes to their health? Let's take a look. Here we will provide 20 core health tips for seniors, caring for the elderly around you. Before we dive in, if you are concerned about the health of older people, please subscribe and activate notifications to stay informed about relevant health topics. Please put 1 in the comments if applicable. Otherwise, type 0. We are committed to enhancing our content to provide genuine assistance. 1. Actively understand aging and deterioration. Seniors should continuously strengthen their self-care awareness, learn self-monitoring knowledge, master self-management skills, and seek early detection and standardized treatment for diseases. For mid to late-stage diseases, they should prioritize maintaining functional function. 2. Healthy diet and balanced nutrition. Seniors should eat regularly and in appropriate amounts. Daily food should include grains, legumes, and potatoes, a balance of coarse and fine, animal foods, vegetables, fruits, milk, and dairy products, and nuts. Cooking oil and salt intake should be controlled. It is recommended that seniors eat 3 meals a day and 2 snacks a day, with breakfast accounting for approximately 30%, lunch for approximately 40%, and dinner for approximately 30%. Add a snack or fruit in the morning and afternoon. 3. Moderate exercise, progressive. Seniors should choose light to moderate exercise based on their individual needs and preferences, such as brisk walking, jogging, swimming, dancing, and Tai Chi. The best times for exercise are 10 to 11 a.m. and 3 to 5 p.m., with each session lasting 30 to 60 minutes. 4. Quit smoking early and limit alcohol consumption. The sooner you quit smoking, the better. If you drink alcohol, limit your intake and avoid strong alcohol with a concentration of 45% or higher. Avoid binge drinking. 5. Maintain good sleep. It is best to take a daily lunch break of about 1 hour. If you have chronic difficulty falling asleep or experience severe snoring and apnea, seek medical attention immediately. If you use sleeping pills, follow your doctor's advice. 6. Regularly monitor your blood pressure. Rest for 5 minutes before measuring. Avoid emotional excitement, fatigue, smoking, or holding your urine. Measure your blood pressure twice with a 1-minute interval between measurements. Take the average of the 2 measurements. Hypertensive patients should self-measure their blood pressure thrice daily, once in the morning, afternoon, and evening. Be alert to morning blood pressure spikes to prevent myocardial infarction and stroke. Also, avoid hypotension, especially hypotension caused by improper medication. 7. Regular blood sugar monitoring. Older adults should monitor their blood sugar every 1 to 2 months, including fasting and 2-hour post-meal blood sugar levels. Diabetic patients should monitor their blood sugar at least once or twice a week when their blood sugar levels are stable. Blood sugar control targets for older diabetic patients should be relaxed appropriately, with fasting blood sugar levels below 7.8 millimoles per liter, 2-hour post-meal blood sugar levels below 11.1 millimoles per liter, or a glycated hemoglobin level between 7.0% and 7.5%. 8. Preventing cardiovascular and cerebrovascular diseases. Older adults should maintain a healthy lifestyle and control cardiovascular and cerebrovascular disease risk factors. This includes limiting excessive fat and salt intake, exercising moderately, getting good sleep, and having regular physical examinations. Early signs of coronary heart disease and stroke should be detected and treated promptly. 9. Be aware of early stroke symptoms and seek medical attention promptly. If an older adult suddenly experiences weakness or numbness on one side of the face or limb, hemianopsia, difficulty speaking, dizziness accompanied by nausea, vomiting, and double vision, call 911 and seek emergency medical attention. 10. Pay attention to decreased visual and auditory function. Avoid casual ear picking. Limit strong tea and coffee consumption. Strictly follow the indications for ototoxic medications, such as gentamicin and streptomycin, and strive for a quiet living environment. 11th, take care of your dental health. Use mouthwash after every meal, floss at least twice daily, rinse your mouth thoroughly, and use the recommended amount of dental floss or toothpicks. Have a dental checkup every 6 months. Repair tooth decay holes promptly, and replace missing teeth promptly to restore chewing function as soon as possible. 12th, prevent falls. Over 90% of fractures in older people are caused by falls. Maintain moderate exercise and wear appropriate glasses to improve vision. Avoid going out alone and in crowded environments. Arrange items indoors in an orderly manner. Increase lighting and keep the floor dry and flat. 13. Preventing bone and joint diseases and osteoporosis. Keep your knees warm. Avoid excessive physical exercise. Minimize stairs and manage your weight to reduce stress on your lower limb joints. Increase your exposure to the sun. Advocate for a healthy, calcium-rich diet, low in salt and moderate in protein. Improve bone strength through moderate exercise such as walking or running. 14. Preventing stress, urinary incontinence. Change behaviors and lifestyle habits that increase abdominal pressure, such as prolonged standing, squatting, carrying heavy loads, chronic coughing, and constipation. 15. Maintain a positive attitude and learn to self-relieve. If you notice elderly individuals experiencing symptoms such as insomnia, headaches, dizziness, tinnitus, depression, restlessness, lack of energy, anxiety over trivial matters, lack of interest in daily activities, feelings of inferiority, self-blame, and guilt, passiveness and overdependence, a sense of meaninglessness in life, or early symptoms of depression such as irritability, fatigue, chest tightness, sleep disturbances, weight loss, dizziness, and headaches, seek medical attention promptly. Consult a specialist for necessary psychological counseling and medication. 16. Prevent the onset and progression of Alzheimer's disease. Alzheimer's disease often develops after age 65 and is characterized by progressive memory, language, and visual spatial impairments, as well as personality changes. Older persons must seek medical help promptly if they experience early symptoms, such as significant or recent memory loss, to stop or slow the onset and progression of Alzheimer's disease. 17th, rational medication use. Strictly follow your doctor's instructions when taking medication. Understand indications and contraindications while staying away from taking 2 or more drugs at once. Overdosing on antibiotics, tranquilizers, anesthetics, anti-inflammatory pain relievers, antiarrhythmics, or cardiotonic medications is not recommended. Stay away from secret recipes, home remedies, proven prescriptions, new drugs, as well as foreign medicines. Do not continue taking the medication unless you have spoken with your doctor immediately if you experience any side effects. 18. Getting checkups regularly. Older persons should actively participate in government and big hospital-sponsored screenings and get at least 1 yearly physical checkup. Keep an eye out for unusual lumps, bleeding in the intestines, and sudden weight loss, as they could be indicators of cancer. Visit a hospital that specializes in cancer treatment if anything out of the ordinary is found. If cancer is detected, seek standardized treatment at a regular hospital. Early detection and intervention of chronic diseases are essential, and effective intervention measures are implemented to reduce the disease risk. Maintain complete medical records. 19. Carry a health emergency card when traveling. The card includes basic information such as name, home address, workplace, and family contact information. Also include information on medical conditions, potential emergencies, and simple first aid instructions. If necessary, include information such as requests for transportation and hospital escort. 20. Promoting healthy, engaged, and fulfilling lives for older adults. Encourage older people to remain engaged members of society. They should participate in physical and mental health-enhancing sports, fitness, cultural, and entertainment activities tailored to their circumstances. Promote a healthy and civilized lifestyle. Focus on reproductive health and avoid unsafe sexual behavior. Promote social care for older people, ensuring access to care, medical care, opportunities for contribution, learning, and entertainment. Thank you for watching our video. If you found this video entertaining, please click the like, subscribe, and share buttons. With your help, we can continue to produce informative and inspiring content for you. We are grateful for the time you have dedicated to viewing it, and we look forward to your participation in the upcoming video.